And the lady was couldn't quite understand it. But the fact was, then she told me what she said. I think you're what, and I wrote down asystematic. I'm never quite sure really what that means, but I think it means that I might have some immune.
Special.
My wife wouldn't even say I'm special, you know. But thank you. You're most complimentary. Most complimentary. But I found out that I didn't have any symptoms, but I did do the isolation as I was instructed because I followed the rules, and that's the way to do it. But the point I'm making is, well, I was fortunate and blessed to one of the ones who was not ill with COVID and was asymptomatic. I was fortunate. This is not the case for many people who did not come through this unscathed. Again, we've all mentioned the figure, 1.5 million people in private households, 2.4% of the UK population across this great nation, United Kingdom of Great Britain and Northern Ireland together, self-reporting ongoing COVID symptoms persisting more than 4 weeks as of the 31st of January 2022. 45%, 685,000 of those first had or suspected they first had COVID-19 at least one year previously.
Yeah.
I think of the wall across there at St Thomas's. I had some ladies, they're not my constituents, but they did a Zoom meeting there about maybe 2 or 3 months ago, and they were from Manchester, Liverpool and elsewhere, and they had reminded me of the wall because I was walking to the hotel one night, and I passed it many months ago and realised what it was. And it's a wonderful memorial and memory to those who have passed on, and also I think it was good to have that event on Tuesday past that the ladies and others organised to have that walk and give people perhaps an outlet, maybe Madam Deputy Speaker, for their feelings. I think it was good to do that. We're 2 years past the first lockdown. The long-term effects of COVID are becoming very clear, and that we need to put protection in place for employees who have got this long-term illness that doctors cannot pinpoint, and yet they must struggle daily to live with it. No DDA form exists to give them any protection whatsoever. I absolutely agree that this government should urgently produce guidelines for employers in both private and public sectors on managing the impact of long COVID amongst their workforce, and further we should launch a compensation scheme which the Honourable Lady referred to. I think we have to do that to all frontline key workers currently living with long COVID. So I agree with the APPG when they say that the scheme should mirror the Armed Forces compensation scheme, which was discussed here on Monday night past here, recognising the relapsing nature of long COVID and go beyond the existing pay scheme. Long COVID is a debilitating illness. My constituent, I'm going to mention this gentleman. I've known him probably ever since he came to ours. He was he's a pastor of a church in my constituency. Almost lost his life in the battle against COVID. He's 6'4". He's a big strapping big man, and he was brought to his knees. He walked up the hill to Stormont as part of his duties as a member of the church, but also because he believes as a voice for the voiceless protest. And I thought he was going to have to lie down. Long COVID has hit him incredibly hard. He has headaches. He's 1 day of good, and then he's 3 days of bad. He has headaches. He has stomach upsets, and he's all those things. But he suffers from blood clots, reduced lung function, chronic fatigue. His church are happy to allow him the rest as he needs. And should he have worked in some other companies, not mention them, he would have no similar protection. This leads me to my next point, that we must improve current long COVID care pathways with a view to improve and to ensure the healthcare system is capable of meeting current and future demand. Can I, Madam Deputy Speaker, mention the Shadow Minister? I do it because there was a debate in Westminster Hall one time, and I mentioned about people, my constituents, and that man I talked about there had brain fog. The Shadow Minister has lived this all himself. I think it's important that we do say that. But here's one of our own friends and colleagues in this House who has lived with long COVID and has found it incredibly difficult, as others have, to deal with that. So you're not far from our thoughts, any of us in the House today, in relation to being...
He is not far from
the right honourable gentleman. sorry, Madam Minister. I'm probably getting carried away in the emotion of the occasion. I apologise. Has the Minister's Department been able to collect the data in relation to those with long COVID? Flexibility for those who are in full-time employment, employment guidelines that the Honourable Lady for Putney referred to. That's what I want to see. I think that's what we all want to see in this House. And perhaps the Minister could confirm that the lessons that have been learned reference COVID-19, as the Honourable Lady for North East Fife said, that there will be other diseases that will come along and we've got to be prepared. So what we learn from this one will make us all the smarter for the next one. And I put it on record because I think it's important when we're talking about these things how well government reacted to the system, the compensation schemes they had for businesses, the COVID-19 vaccine. Those are positives, and they give us heart whenever perhaps maybe at some stages we were down in the dumps. So I think we want to say that as well. Roughly 4% of UK's workforce, I conclude with this, Madam Chair, roughly 4% of the UK's workforce has had long COVID, and I'm given to understand that 82 million work days were lost due to long COVID absence in NHS England between March 2020 and September 2021. The real figure may be higher, as long COVID was not classified as a reason for absence at the start of the pandemic. It is clear that the effect on business is real. And that's why this debate today. And there has to be structures in place to deal with this. Again, I thank the Honourable Lady. I thank everyone for their contributions. I look very much to the Shadow's contribution. But the Minister is a friend of us all. I look very much to what he will say. Thank you.
Marion Ferris.
Thank you, Madam Deputy Speaker. And it's a pleasure to speak in this debate. And I'd like to thank the Honourable Member for Oxford, East and Abingdon, sorry, I beg your pardon, West and Abingdon, and all the other folk who have spoken already in this debate. And can I mention the member for Oldham East and Saddleworth who talked about staff being disciplined because they have long COVID. The Honourable Member for City of Chester who gave a really personal testimony and really explained to me much more about how it affects families in its entirety. And to the Honourable Member for North East Fife who really, the application forms are the bane of all of our existence. And if you are not well, then it just becomes far more difficult. The Honourable Member for Putney, who especially raised the idea of employer guidelines, and the Honourable Member for Strangford, who of course gave his unique take on this, mentioning his wife and family, and really bringing a real personal touch to the debate. So I thank all of them. Madam Deputy Speaker, the scale of long COVID can't be underestimated, as we've heard, and has a significant impact on the UK workforce, especially affecting key workers. The ONS latest monthly estimates show that over the 4-week period ending 31st of January this year, an estimated 1.5 million people across the UK self-reported experiencing long COVID, 2.4% of the population, including 119,000 folk in Scotland. And this data shows that long COVID systems are persisting for longer than 4 weeks, appear to have a higher prevalence in working age adults between the ages of 35 and 49. And a survey last month, which has already been referred to by the Chartered Institute of Personnel and Development, the CIPD, found that a quarter of UK employers cited long COVID as one of the main causes of long-term sickness absence among staff. These are things that we're now having to deal with, and key workers themselves appear to be more at risk of long COVID, and that really has to be looked in. We're still learning the true impact of long COVID on an individual's physical and mental health. And we know that what the most common symptoms are, but we still don't understand long-term issues. And the CIDP report points out that as a new condition, people sometimes don't know that's what they've got, and it takes quite a long time for a diagnosis to be given. And again, there's a double burden of uncertainty regarding how best these folk with long COVID can navigate their work, and that's really affects sickness absence and return to work. These are all.
Will the Honourable Lady give me?
On that point, yes.
Just very briefly on that, yes, that is one of the key issues for first waivers with long COVID, the fact that they didn't necessarily have a COVID test. And I do think that's something that Department for Work and Pensions, the government should look at in terms of when GPs are looking at a list of symptoms that can only be long COVID, there's an acceptance that that is what they're suffering from.
Indeed, and as we've already heard, and I thank the Honourable Lady for her intervention, and as we've already talked about, some members have already spoken about ME, and where it's very non-specific and can be different, it's quite difficult sometimes to diagnose, but people should be believed, and I think that's the main issue I would raise in regard to that. Support is already being delivered across Scotland for those suffering from long COVID, and the Scottish Government is indeed committed to do more. And they recognise and acknowledge the impact that long COVID can have on the health and well-being of those affected, and has encouraged all employers to apply fair work principles and a flexible approach to dealing with the impacts of COVID-19 in order to protect the health and well-being of the workforce. In the event NHS Scotland staff are absent due to COVID, current temporary measures ensure they are paid as if at work and are not subject to corresponding sickness absence triggers. And the Scottish Government continue to support NHS colleagues with the provision of these temporary sickness absence measures in the event they contract COVID-19. And again, the Scottish Government has a long COVID strategic network which actually helps to bring things, it brings together clinical experts, NHS boards and lived experience, because that's one always in any disease or any issue, lived experience really can give those who are trying to help a real experience of what is needed to be done. Following analysis and planning by the Strategic Network to identify where additional resources is needed, the first tranche of funding to NHS boards will be made early in the next financial year, which starts tomorrow. The fund will provide additional resource to support NHS boards to develop and deliver the best models of care appropriate for their populations. But Madam Deputy Speaker, this is about the effect on the workforce, and it's really important that workforce know what's maybe wrong with them. It's really important that employers know what long COVID is about. So the Scottish Government carried out a marketing campaign in October and November last year to raise awareness of it and to signpost people to appropriate support. The campaign supported the production of posters for displaying community pharmacies, GP surgeries across Scotland, in different languages, social media posts, and a campaign toolkit sent to 250 direct partner contacts, with the additional distribution of approximately 3,000 plus other places that it went. I want here to mention again the APPG and the good work that it has done. And it recommended that the UK Government commits £100 million per annum to funding research into diagnostic and treatment pathways for long COVID patients. And again, the Scottish Chief Scientific Officer's Office is funding patient-led, Scottish-led project with total commitment to funding. And again, the work there is being done and it's being disseminated widely. Madam Deputy Speaker, I think I cannot finish this without talking about statutory sick pay and the effect that that has on people with long COVID. It's having a disproportionate impact on groups already disadvantaged in terms of work and health. And to limit further health and inequality, the UK Government must ensure a livable sick pay for all. We're clear that in the SNP that we need to have a system fit for the 21st century, and we really need to look at those people who are earning the least, because you can't even get statutory sick pay if you're earning less than £120 a week, and that's the case for many. And the fact now that the government has moved away from statutory sick pay from the first day of sickness, this impacts hugely on people. And it's quite ironic, Madam Deputy Speaker, that the Prime Minister claimed we should be more like the Germans and not go to work when we're sick. Well, considering that Germany is one of the best sick pay systems in Europe, with laws requiring employers to pay staff 100% of wages for the first 6 weeks of sickness, and by contrast, the UK has one of the lowest. I remember in this chamber listening to a member in the benches opposite saying that £96.35 a day was quite a good statutory sick pay benefit, and when she was told that it was £96.35 a week, she was quite shocked. And I was quite shocked that she didn't know that. It's absolutely appalling. I mean, we are one of the richest countries in the world, and people can't afford to stay off sick. I mean, it's just disgraceful. And the fact now that, you know, you have to qualify and wait, is it 2 weeks before you can even access it, is just absolutely ridiculous. This government didn't bring in an employment bill in the last Queen's speech. It should in the next. Flexible working would also help people with long COVID. It would help them in the days that they are better able to work and they would have to trail into work. Again, there was a BEES consultation. Can we find out what's ended over 3 months ago? Can we find out what's happened? So, in conclusion, Madam Deputy Speaker, while employment law remains reserved to Westminster, the SNP Scottish Government are using the Fair Work policy to promote fairer working practices across the labour market in Scotland. And I really would urge the Minister to look at what's happening and to look at statutory sick pay, to look at helping people, not just with long COVID, but as this is the subject of this debate, really that would be a huge improvement in the lives of those unfortunate to have this terrible condition.
Shadow Minister Andrew Gwynn.
Thank you very much, Madam Deputy Speaker, and I would like to begin by sincerely thanking the Honourable lady, the member for Oxford West and Abingdon, for all the work she's done on this particular issue, but also for the way that she opened this debate today. I'd also like to thank the Backbench Business Committee for granting it. Thanks also to the members that have taken part in the debate, in particular my honourable friend, the member for Oldham East and Saddleworth, my honourable friend, the member for Chester, and I thank him sincerely for his kind words. It's nice to know that my experiences have helped somebody else with theirs, and I wish his family member well for the future. Also, the Honourable Lady, the member for North East Fife, my honourable friend, the member for Putney, and she's absolutely right to draw parallels with ME too, both in terms of some of the symptoms, but also how that particular community has been treated over a number of years. My honourable friend, because he is my friend, the member for Strangford, for his kind words too. Madam Deputy Speaker, as colleagues will know, not least because it's been mentioned in the course of this debate, long COVID is an issue that is very close to my heart. Back in March 2020, I first caught COVID. Madam Deputy Speaker, that was 107 weeks and 4 days ago, and I am still struggling with some of the symptoms of long COVID all these weeks and days later. Back then, I felt rough with COVID, but to my relief, avoided a lot of the more serious symptoms that we were seeing on the news and hearing from friends and colleagues at that time. It wasn't great, but I wasn't hospitalised, was the blessing that I had. However, when my self-isolation period ended, and in theory I should have been fine to return to work, I found that I couldn't. I found that I was perpetually exhausted. I couldn't catch my breath. I would be talking to my wife and suddenly words would vanish. I would try and pick them out, but I couldn't find the right ones. I would forget things, lose track of why I came into a room. I would sweat like I'd run the London Marathon just for doing routine day-to-day things, like making a cup of tea. I felt completely terrified. My symptoms weren't going anywhere. Instead, they were evolving into something different and seemingly something permanent. In May of 2020, Eliza Perego coined the term long COVID to describe these persistent and wide-ranging symptoms. I felt like a bright light had been shone on what I had been going through, and we now know that over 1.5 million people suffer with long COVID in the United Kingdom, and that the majority of these, 989,000, say it affects their daily activities. It certainly affected mine. I'm very fortunate to have a brilliant team across Westminster and in my constituency of Denton and Reddish, and they stepped up on my worst days, when getting out of bed literally felt like running a marathon. They made sure that my constituents were still well represented and that I was given sufficient time to rest when needed. And that was a hard lesson too, listening to your body. However, millions of people in this country are not as fortunate as I was. We have some of the worst sick pay provision in the OECD. We are in an age of precarious work. And in this context, long COVID becomes an economic as well as a health emergency. The fact of the matter is, Madam Deputy Speaker, that there has been an acute failure on the part of government both to take long COVID as seriously as perhaps it should, because it isn't just a health issue, it is an employment and a DWP issue. And government could, and I believe should, be doing more to encourage workplaces to better support those suffering from long COVID and to allow employers to understand precisely what long COVID means for their workforce. From December 2021 to January 2022, the most recent time period we have access to, it's been shown, as I say, that of the 1.5 million people currently suffering from long COVID, only 2,869 had attempted to access the post-COVID assessment service. Of that tiny number, 34% had been waiting for longer than 15 weeks. Something is going very wrong. Almost 1 million people are reporting long COVID symptoms that are adversely affecting their day-to-day lives, yet just a fraction are attempting to access care, and only a fraction of those are actually getting it. Now, I would be grateful if, in his response, the Minister could set out what conversations he's had with colleagues in the Department for Health and Social Care about these figures, and what action the government will be taking to ensure that those who have long COVID can actually access the care that they desperately need. Because this is actually quite crucial. Because for a proportion of those people, with the right rehabilitation package, work can become viable again. And I want to share with him some data that I've received from Nuffield Health. Now, they operated a free 12-week programme, and so far they've helped over 1,900 people from across the UK to recover from prolonged effects of COVID-19, including breathlessness, anxiety and fatigue. And I was one of the 1,900 that took part in this free programme. The results that they have to date shows that 64% of them, it improved mental well-being. For 39% of them, it improved their functional capacity. For 39%, it improved their breathlessness. For 35%, they saw an improvement in fitness. And for 30%, not an insubstantial number, they were absent from work but felt that they could return. Now, it's not a silver bullet for all, because those are still minority figures, but for 30% to be able to return back to work with the right rehabilitation programme, I think that is something quite encouraging. Now, as has been pointed out on numerous occasions today, 4% of the UK workforce currently have long COVID. That is an extraordinarily high number and will no doubt be having an impact both on workplace productivity but also on wider employment outcomes. The Chartered Institute of Personnel and Development found that a quarter of UK employers cited long COVID as one of the main causes of long-term sickness among their staff. Yet those living with long COVID have had very little in the way of workforce protection. Now, in my capacity as Shadow Minister for Public Health, I have been inundated with stories of employees facing an uphill battle to have reasonable adjustments implemented in their workplace. I've heard from doctors unable to return to work, of NHS staff who've been sacked or had contracts terminated because of long COVID symptoms. These are people who carried us through the pandemic, people who we stood on our doorsteps and applauded. We can do much better than this. Now, Madam Deputy Speaker, I want to just talk about the help that I had in returning to work, and I want to pay tribute both to Mr. Speaker but also to the staff in the Speaker's office, because I am lucky to work in an environment where reasonable adjustments were made. When I first returned to the House in person after the summer recess, I found that I couldn't bob in the chamber without becoming incredibly fatigued, and then that would trigger my brain fog. And after almost collapsing during a ministerial statement on Afghanistan, where I'd been bobbing for almost an hour, I arranged it for a meeting with the Speaker on the basis that I can't do my job. And if I can't do a simple task like bobbing up and down, then I may as well pack up and leave. I can't do my job. And it was the Speaker and his brilliant staff who advised me that instead of rising on each occasion, I could simply just hold up my order paper. A simple solution that made a huge difference to my health and well-being, and I thank the Speaker sincerely, and indeed you, Madam Deputy Speaker, and the staff in the Speaker's office for being so understanding. But reasonable adjustments shouldn't just be made for members of Parliament. The government needs to be doing much more to empower employees to approach their bosses and to have these kind of conversations. The problem is, with practically zero workplace protections for long COVID in place, these conversations become incredibly difficult to have. Now, we on this side of the House recognise the threat that long COVID poses both to the health of this nation but also to the British workforce. That's why we would end the postcode lottery of long COVID care provision, we would fix the shameful state of sick pay, and we would engage with employers to support those with long COVID. Yeah. COVID has not gone anywhere, and it is profoundly irresponsible to just stick fingers in ears and pretend that there aren't 1.5 million people still struggling. Tomorrow, free lateral flow testing will end, and as a result, COVID cases will rise. This makes it much harder both to track the level of COVID in the UK and, by extension, the amount of people who will potentially then go on to develop and live with long COVID. So, I will give way.
I'm extremely grateful to him giving way, and I'm glad he's brought up this point, because he will have heard the difficulties that people have in accessing benefits, in proving that they have long COVID. You get long COVID by having had COVID, but if you can't get a test, then how do you know that you had COVID? And therefore it just makes it so much more difficult to prove down the line to access the benefits that they so deserved.
The Honourable Lady's absolutely right, and this is a real concern of mine, not least because I've experienced it. I was in the first wave of COVID. I literally caught COVID the weeks that the government said, if you develop symptoms, you no longer need to test, you just go into self-isolation. I knew I had COVID, and I know that COVID led to long COVID. I still to this day can't prove it because there was no routine testing available to be able to show it. So that is a real issue. And I am incredibly worried, Madam Deputy Speaker, that getting rid of free testing is a short-term decision which will have a major financial and public health implication for the foreseeable future. The government can't turn a blind eye to a problem that is having a devastating impact on the people of this country. One of the defining lessons of the pandemic is that we don't have the luxury of dithering and delay when it comes to public health. We urgently need a cross-departmental long COVID strategy, one that I would support, and I would gladly work and use some of my experience and advice with ministers to help develop. We need a long COVID strategy. We need proper sick pay, and we need the government to understand that it has an important role working with business and with industry to ensure that reasonable adjustments and support in the workplace can become a thing for all and not just for me.
Minister.
Thank you, Madam Deputy Speaker, and I'd like to congratulate the honourable members for Oxford West and Abingdon, who opened this incredibly well, and Oldham East and Saddleworth, and indeed my honourable friend, the member for Central Suffolk and North Ipswich, who unfortunately couldn't be here, for securing today's important debate on the impact of long COVID in the workplace. And I'd like to thank the Backbench Business Committee and all of those who have taken part in the debate for their thoughtful and insightful comments. We've heard about the ONS estimate that over the 4-week period ending 31st of January 22, 1.5 million people in the UK reported experiencing ongoing symptoms following COVID. And out of those 1.5 million people, nearly 300,000 reported that their ability to undertake day-to-day activities had been significantly limited. And it's clear, therefore, that long COVID, as we've heard, presents a growing challenge for the workplace and more widely. Now, that emergence of a completely new condition, like long COVID, is a real rarity. Much like our experience of the COVID-19 pandemic itself, we must and are constantly developing our understanding. We put support in place for those suffering from the condition. NHS England has to date invested £224 million to provide care for people with long COVID. It's established 90 long COVID assessment services across England, and those services are assessing and diagnosing people experiencing long-term health effects as a result of COVID-19 infection, whether they've had a positive test or are likely to have long COVID based on those clinical symptoms, regardless of whether they were admitted to hospital during their COVID-19 illness. The services offer physical, cognitive and psychological assessment, and where appropriate refer patients onto existing services for treatment and rehabilitation. I know that the Honourable Lady talked about the $1 billion in the States. I have to say that not all of that has been allocated yet, and the UK is already ploughing ahead, and it's quite far ahead compared to other countries, including the States, in their research in this area, but clearly there's more we can always do. Getting that right healthcare and treatment in place for individuals is clearly an essential step for them and for their employers and for the wider economy. But the theme of today's debate is the impact of long COVID in the workplace. Now, people can suffer from many long-term health and other conditions which may impact on their work. We've heard about ME, we could talk about fibromyalgia, we could talk about Guillain-Barré, Miller Fisher, all of those kind of things. And indeed, there's other areas that are not necessarily post-viral. Earlier this month, I gave evidence to the Women and Equalities Committee on the impact of the menopause in the workplace. And in February, I responded to the government at a Westminster Hall debate on supporting people with endometriosis in the workplace. Again, very different conditions, but nonetheless long-lasting, and areas that we need to make sure that we can keep people with the right treatment, the right reasonable, and indeed in